Eddie, I wanted to show you this piece I wrote at the Griot a couple months ago, where it was horrifying to me. And I think some of these messages, as we've seen this surge, also have to be about telling particular communities the danger. We've talked before about heading into Thanksgiving. We've talked before about people not traveling. I pointed out in my piece that black people are dying of COVID at a rate higher than we died during the Middle Passage. That COVID death rates have wiped out what amounts to the entire AUC, Morehouse, Spelman, Morris Brown, Clark Atlanta. What do you think needs to be the message heading into, again, a holiday season where people are going to travel? What needs to be the message in the black community about how serious this pandemic is and how we need to change our behavior above and beyond the things that we can't control?
My goodness. First of all, it's great to see you, Doc. But Jason, it's so difficult to put into words what you've just laid out in terms of my feelings. Look, it seems to me that we have to ask ourselves the question, are you going to be complicit in your own death? Right? That there are some things we can control, and we need to ask ourselves, what are those things? Because if we don't, we're going to be complicit in the deaths of folks we love, and we won't be able to say goodbye to them properly. And so I think it's important for us to continue to lay this out, but we also have to describe the background conditions. We know hyper-concentrated levels of poverty. We know what it means to live in certain areas and how staying at home or sheltering in place isn't a feasible idea. We know we're disproportionately represented among essential workers. We know we're disproportionately represented among those who take public transportation. We know that there are choices that aren't really in our hands that actually place us in harm's way. So the underlying condition, as Doc laid out earlier, is American racism. You think about what happened in the pandemic of 1918, 1919, Jason. We died disproportionately there, too. Hospitals were segregated. We did not have access to broad health care. They didn't even count our numbers in so many ways. Hyper-segregated communities made us more susceptible, right? We died at extraordinary numbers and folk didn't care. And it's almost like this repetition of history, right? So the underlying condition that places us in harm's way requires us to name it for what it is. And that is this country's general disregard for black life and how historically that has been made manifest and how it's being made manifest now.
In doing research for a book this summer, I looked at old articles in the Chicago Defender and Baltimore Afro that talked about how eerily similar this pandemic was to the fact that initially in this pandemic there was sort of a stereotype, oh, this isn't something that black people get. People were saying that 100 years ago. To the nurse shortage and the fact that discrimination kept African-American nurses from being able to work in certain places. Aaron, one of the other things that we've seen in a lot of research and some of the reporting is that African-Americans have legitimate reasons to distrust and have concerns about the healthcare system. From a reporting standpoint and from an informational standpoint, how do we break through people's anxieties and fears about going in to see doctors? Because I encounter a lot of people who say, look, I'm coughing, I'm sneezing, let me take some Robitussin. I'm afraid that if I go into the doctor, that I'll actually catch COVID.
Yes, and listen, that is a legitimate concern. With hospitals having to deal with the surge of the coronavirus pandemic, that is a place where people are worried about protecting themselves, both the frontline workers who are there and patients who may need to come there for any number of reasons, including the coronavirus pandemic. But listen, my reporting has shown this cycle that especially a lot of those same people, the same black women especially, who were doing a lot of the organizing around this election, were also checking in with those same black communities around their concerns about coronavirus. So asking them, do you have PPE? Are you taking the correct precautions that you need to take in terms of social distancing? What are the things that you need? And not just from a public health perspective, but also from an economic perspective, because we know, to Dr. Gaugh's point, that you have Black folks who are those essential workers, those frontline workers who a lot of times are coming home to multi-generational families but have to make the choice between earning a living and protecting their public health. And so, you know, with that being the case, we're in a very dangerous season where, you know, the black and brown community are getting a very wrong dual message that not only are your votes in question, but really there's a question of whether their lives matter, because we are not centering, frankly, black and brown people as the ones who are being disproportionately affected, not just from a public health perspective, but also from an economic perspective. We're disproportionately food insecure, housing insecure, everything from student loan debt to, you know, you name it. These inequalities that have been laid bare are definitely affecting black and brown people, and they need to be front and center in this pandemic so that people can understand the seriousness of the toll of this on those communities in particular.
Dr. Ashby, really quick, because we're running up on a break. You're sitting in front of President-elect Joe Biden. You have 30 seconds to explain to him what targeted policies need to be implemented to specifically address coronavirus in the black community. What do you tell him?
Oh, I appreciate you. So first and foremost, we're in the middle of a surge, okay? So the main issue that I'm concerned about is access to therapeutics, more specifically outpatient therapeutics. So we have the Eli Lilly antibody therapy out. I have no idea how to get that for my patients, and that's an outpatient therapy. We're going to deal with these county hospitals getting overrun. Same thing that happened at Elmhurst, same thing that happened in Brooklyn. Same thing that happened at Elmhurst, same thing that happened in Brooklyn. They're going to have an issue with capacity, and we need to have plans in place to redistribute patients and redirect them to other hospitals with capacity, and not have patients there with a nursing ratio of 10 to 1 dying in the hallways. So that needs to be taken care of right now. But in addition to that, we need targeted programs that actually go in and connect with the people who have gained the trust of the community, first of all, to then inform them and provide that information and also access to care. Okay, so there was a bunch more, but I'll just leave it there.
That works. That works. Thank you so very much, Dr. Bernard Ashby, Eddie Glaude, Aaron Haynes. This is a very, very important issue. I hope the Biden administration is listening.